My group performs cardiac catheterizations for one of three main reasons. One is for patients who are referred to us or patients we see in the emergency room who are having chest discomfort, which is concerning that the chest discomfort could be arising from the heart muscle itself. The other reason for performing heart catheterizations are for patients who have abnormal stress tests, whether they be nuclear stress tests or regular treadmill stress tests. And one of the main reasons we do heart catheterizations are for patients who are actively having heart attacks. Once the heart catheterization is performed and we identify that there is a blockage that's very concerning, and the blockage is essentially plaque inside that blood vessel which is limiting the flow downstream in that blood vessel, then we have to consider angioplasty and stenting. Angioplasty is actually where we open up the blood vessel, and that's by a balloon that's mounted on a catheter, and we inflate this balloon inside the blood vessel and it crushes that blockage against the vessel wall. It's very similar to stepping your foot into fresh snow and how it presses down on the ground. Well, the same thing happens when we inflate that balloon and press that blockage against the vessel wall. But this day and time, standard of care is actually to perform stenting following that balloon angioplasty procedure. The stenting process involves us going in with a stent, which is a wire cylinder that looks like the spring in the end of a ballpoint pen. And this wire cylinder is again mounted on a balloon that goes into the blood vessel. We inflate the balloon, which therefore inflates the stent, and it again presses that plaque and that blockage against the blood vessel wall and opens up blood flow so that we get good downstream blood flow as well. And at that point we can hopefully reduce the patient's chest discomfort that he or she may have been having, correct the abnormality we've seen on the stress test, or save the life of the person having the heart attack.